Hi everyone, my name is Ning. I'm from the Histotripsy lab at the University of Michigan. Today I'm presenting our research updates on transcranial MR-guided histotripsy in vivo pig treatment. As many of you know, transcranial MR-guided focused ultrasound is a cerebral ablation technique that can be used to treat essential tremor and other brain disease. However, there are several limitations due to the nature of cerebral ablation, including skull overheating, limited treatment location profile, and long treatment time for large volume targets. In comparison, transcranial histotripsy uses short pulses with peak negative pressure larger than 26 megapascal to mechanically fractionate the target tissue. Our preliminary study has shown that histotripsy can treat wide range of locations and volumes without overheating the skull, and specialized MR sequences has also been developed to monitor the cavitation events in real time. So the goal of this study is to demonstrate the feasibility and safety of transcranial MR-guided histotripsy in vivo treatment. To do the treatment, we first developed a transcranial MR-compatible histotripsy system, which includes a 128-element 700 kHz array with focal distance of 15 centimeters. This array was characterized acoustically to give us focal pressure through the human skull with aberration fraction of 72 megapascal, which gives us plenty of headroom above the intrinsic threshold for treatment. And for a large volume target, electronic focus steering can be done within 25 millimeter on 3-axis. The array was made to be MR compatible by using minimized mass of metal, and the drive electronics was placed in an adjacent MR control room. So here's our workflow for transcranial acute treatment. As the pig skull is too flat and thick for ultrasound to propagate through, a craniotomy was performed to remove part of the pig skull, and this was done 2 days before the treatment to avoid any air bubble trapped within the incision. On the day of the treatment, we set up our system in MR scanner, and except the human skull was placed over the pig head to do the transcranial treatment. Aberration correction was done to improve the efficiency of our treatment. Then we take pre-treatment scans and identify the target zone based on our fiducial markers attached to the array. After that, the treatment was delivered using preset parameters, and post-treatment scans were taken 2 to 4 hours after the treatment before we euthanize the pig. So here are the treatment parameters we've been using for the pig treatment. The figure on the left side here is showing the setup as I described, where we have the transducer at the bottom, and the ultrasound propagates through a human skull into the pig brain. And the figure in the middle here is showing a cavitation bubble cloud during the treatment, as identified as the red arrow here from our real-time monitoring. And the video on the right side here is showing high-resolution T2 images 2 hours post-treatment from one of our pig treatments. Here are more results from our pig treatment. As you can see on the images here, the histotripsy ablation zone can be observed on both T2 and T2 star images, and the ablation zone was well confined without any excessive bleeding or edema observed. The histology slides on the right side here also showing the ablation zone correspondingly. And these are the MR images and histology slices from a different pig we have been treating. With higher magnification, we can see that on the histology slice, the bleeding zone was very well confined, and some homogenized pig brain tissue was left within that bleeding zone. And the neurons outside of the target zone stay intact and normal after the treatment. So overall, we have shown that histotripsy ablation was successfully generated in brain of 4 pigs through the human skull with no excessive hemorrhage or edema observed by the time of euthanization, and neurons outside of target zone remain intact. These results demonstrated the feasibility of transcranial MR-guided histotripsy for in vivo pig treatment and enabled further investigation on MR-guided histotripsy. Some future work will be involving evaluating the treatment envelope, assessing the pre-treatment targeting accuracy, and further evaluation of post-treatment edema and inflammation in subacute groups. With that, I would like to thank all my colleagues and collaborators and the Focus Ultra Foundation for funding this project, and I will end my presentation here, and I'm happy to take any question now. Thank you.